In our country, we spend close to $5 trillion now, coming up on $5 trillion on healthcare. And although primary care directs about 80% of those costs, we actually only dedicate 5% of all the healthcare expenditures on primary care. Let me say that again, only 5%.
If you've had trouble getting in to see your primary care provider, you're not alone. An analysis from the National Center for Health Workforce projects a shortage of more than 87,000 primary care physicians by 2037, meaning longer wait times and shorter visits. Recently, I talked with Zeev Neuwirth, a physician, healthcare executive, and host of the podcast Creating a New Healthcare, about what the future holds for primary care and the patients who depend on it. Why can I never get in to see my primary care physician? Why does it take so long to get an appointment? When I am there, why am I not there as long as I feel like I should be? Why don't they have a lot of time to spend with me? What's going on in healthcare? What are some of the challenges that primary care is facing?
Yeah, the issue of primary care is at the same time a simple issue, a simple problem to understand, and a very, very complicated problem to understand. And the first thing I want to say is you can't point your fingers at the primary care doctors themselves. Having myself practiced primary care for many, many years, and also having gone to primary care physicians as a patient and a family member of patients, I understand both sides of the stethoscope, so to speak. The issue really at a macro level is I think the best way to understand it. In our country, we spend close to $5 trillion now, coming up on $5 trillion on healthcare. And although primary care directs about 80% of those costs, we actually only dedicate 5% of all the healthcare expenditures on primary care. Let me say that again. Only 5% of all the dollars spent in healthcare in the United States is spent on primary care. And that, just to put that in some relative terms, in every other developed nation and even underdeveloped nations, the percentage of healthcare dollars that are spent on primary care are typically 3 times that amount.
I've done a podcast episode for a different show about primary care before. And at the time I was recording that episode, I have an 8-year-old daughter. So I have 3 kids. I experience healthcare through being a parent, as well as being a patient. And my 8-year-old daughter at the time had strep throat. Pretty simple, right? You know, you have the symptoms, you go, you get the swab, you get the meds, you get better, everything's fine. And I got it from her, of course, because I'm her mom and I get everything. But while I was talking to this physician, I looked up, if I took my child to her pediatrician to treat this, when could we get in? And it was months. And I looked up, if I went to my physician for this, when could I get in? It was also months. That's not practical when you have an acute illness, even something so straightforward as strep, which, you know, all of my kids have had even since then.
Right.
So, you know, but for us, there were options, right? There are walk-in clinics.
Right.
There is, you know, there are other places. And because of where we live, we have easy access to that. That was a pretty easy fix for us. But not everybody has those options. Sometimes there are virtual options. Sometimes there are barriers to that. But given that it could be months to actually get in, you know, if you're talking about a checkup, you just know, right? You have your annual physical, you make the appointment months before you need it, and you're okay. But if you're talking about an acute illness or even a chronic illness where you need to see your physician for things, how do you see the role of primary care changing and how we use our primary care physicians?
Yeah, because of the paucity and increasing shortage of primary care physicians, and even I would say other primary care clinicians, nurse practitioners, APPs. Uh, there are all these sort of auxiliary channels that have emerged, right? So uh, one is obviously urgent care, right? And so the walk-in clinics you were talking about. Another one is virtual care, another option you talked about. And these companies have emerged, and they're a significant part of the industry. And another one which most are unaware, and I would say it's interesting that it hasn't taken off yet in the way it could, but sort of like do it yourself, like these kits, right? So something like that. Why couldn't you be mailed a kit by a company, take out the swab, do it yourself, put it back in the kit, get a response literally within 12, 24 hours. I mean, Amazon could deliver in a matter of minutes, right? So we could see that. And then, you get a call and, someone would call in the medication if in fact it was strep throat, and that would be delivered to your doorstep. And literally that can happen. I mean, technically it could happen literally in hours that you could get that turnaround. There are companies that actually do that as well. And so companies like that, this home kit sort of approach has emerged. So I do think that there are channels that are emerging. There are challenges to them. They haven't grown as I thought that they would take off. Quite honestly, I've been looking at this for years, and I was assuming that those alternative or auxiliary channels would take off. I'm not sure I have an answer for why they haven't. I think what we're going to have to end up doing is what we're going to have to do what third world countries do, which is basically deputize people who are not clinicians to go and do healthcare. There are, community health worker types in other countries that get trained, and they go literally on mopeds into rural areas, into people's homes. They do checkups and visits, and they could do things like, stress tests and basic stuff that they can be trained to do. I mean, quite honestly, you don't have to have an MD or even, any sort of clinical degree to do, some of these things, especially if, you can imagine, like, if I, as a primary care physician, was sitting here sort of like in a control room, right? If this was a control room and I had at my disposal hundreds of community health workers, I could direct them to take care of a whole community, to go out, see that elderly patient. I could, pop in virtually while they're there and supervise certain things.
You bring up something interesting, because something that I hear a lot of when talking about shortages of any kind, but especially when it comes to physicians, is, there are nurses, there are PAs, there are other folks who are not working kind of at the top of their license. They can be doing some of the things, but there are shortages of those folks too, right?
Absolutely.
So
yes,
it's interesting to think about kind of even bringing another level into this, and and kind of in a way that we have not experienced before.
Yeah. I mean, if I was at Health and Human Services at the federal level, that would be one of the innovations I would be working on, is how do we train? I mean, there are people out there who would love to do this work, and could we create a training program that is literally months, get people qualified enough to be able to, to follow the direction and under the direct supervision of a clinician and, carry out this thing. So it's a very, very innovative solution. Although, again, if you look at other countries, they're already implementing it out of necessity. And I can see us doing that. When it comes down to it, a lot of what you do is actually not technical clinical work. And so there are other people, quite honestly, that could be leveraged, who actually have expertise and who are adept, who have innate skills at talking to other people, empathy skills. They understand the challenges people face, financial issues, housing issues, all the social determinants of health. That really is what most people really spend most of their time in terms of what they actually need help with. And we've lost sight of that fact. We've lost sight of the fact that most of health has to do what you and I do every single day. Do we get enough sleep? What is our stress level? Are we eating appropriately? You know what the number one predictor of your health and your longevity is? You know what it is?
I don't, and I'm a little worried that whatever it is, I'm falling short, but tell me.
I don't think you are. It's your financial status. Whether you're employed
Makes sense.
and have money. That is the number one predictor of health and longevity. And so, and that's why I was saying, if I was at HHS, if I was at Health and Human Services, I would bring in the other departments and realize that health is not just about clinical care. And if you really get down to the evidence, most of health isn't about clinical care. Clinical care is really sort of like what we call primary care should be secondary or tertiary care.
So I personally have been working kind of in the healthcare space for about 10 years, which means that my knowledge is about an inch deep. There are a lot of people, yourself included, who have been in it a lot longer than I have, who know a whole lot more than I do. And when I meet these people, everyone seems to agree on one thing, that we have a system that does not work great. The word I most often hear is broken. And that's in every aspect of healthcare, right? But one of the tenets of Hi-Fi Health News is that the system might not be what you want. We can work toward a better system. There are a lot of ideas about what kind of system would work best in this country. But until the point when we have something better, we still have to navigate what we've got. So how can a patient best navigate this primary care issue? How can you make the most out of your relationship with your primary care physician? Or if you want to stay well, or if you are managing a chronic condition and you feel that you're not getting the attention that you need, what is the way forward there?
Wow. I do think having a primary care provider, having someone in your corner, getting to know them getting to know you is actually really important, because when you need them, and if you haven't cultivated that relationship, you won't have them. And then you're scrambling.
Thank you so much for coming on and talking about all this. There are so many threads here we could pull at, and I hope to in future episodes. But yeah, thank you so much. I think that the listeners will be very happy to have this information. So Zeev Neuwirth, thank you for joining me.
Thank you, Erica. Pleasure.